Everybody for being with us today. First, as recent events of the weekend, a number of our Aveshka team members are involved and are responding to and have had personal involvement with the tornadoes in Kentucky and surrounding states. And so our thoughts are with them, and we know that our team members are working very hard there. Today's public health town hall is once again focusing on COVID-19. We have all been at this for a very long time, and we know that it has been impacting all of us and all of you professionally and personally. Today's goal is really to give an update on a number of the issues that we're all facing, and probably most importantly, to answer your questions. So feel free to put the questions in the chat, and we'll answer as many of them as possible. And anything that you'd like to ask offline, as usual, feel free to ask a member of our team. In many of our past forums, we've had only really a couple of members of our team publicly presenting, and that's not to say that we don't have a large and talented team. And so today, what we're going to do is have two members of our COVID-19 team talk with you a bit about a number of issues. Some of us are more public facing, and as usual, we are supported very heavily and very ably by a large team that has been supporting our clients and educating and training and teaching all of us how to better analyze the data, how to better communicate in really a challenging situation. And so two members of our team today we're going to feature and have present to you about in areas of their expertise. And then we'll follow that with some comments. In the lead off is going to be Anna Morris. Anna, as a member of our team, has really been with us for 2 years, since March of 2020. She's a member of our dashboard team, is really a data and science expert, supports the FDIC Crisis Readiness Program, and comes to us with a master's in biodefense and really extensive knowledge of data and analytics, and really supports all of us on a daily basis. Following Anna will be Tom Slater. Tom is also an important member of our team, really with a profound expertise, over 30 years of experience in public health communications, which is a complex and difficult subject, and really something that's been an important part of our COVID response. He's really nationally recognized in this, in crisis communications, and we'll be following Anna, and then we'll turn to our own Dr. Michael Anderson for some comments. You've heard of him before, and his pediatric critical care expertise and health management expertise, and then we'll turn to questions. So without further ado, Anna, I'm going to turn to you and look forward to your presentation.
As of right now, we all know we're still in the middle of a pandemic. Right now, we're seeing 3 barriers impacting the control of COVID-19. The first of those barriers is the variants that are emerging. COVID-19 is a virus. We all know that. Viruses mutate. We all know that at this point. And we are seeing variants emerge as expected. Some of the variants that we've seen emerge range from Alpha variant, Delta variant, and now Omicron. The second barrier to that's impacting the control of COVID-19 is low vaccination rates. There are parts of the US that are very highly vaccinated, and some states have done a really good job, but there are still lots of areas in the United States that have low vaccination rates, including the central US and the South. The third barrier that impacts the control of COVID-19 is behavior. We know that there are holidays coming up. There was just a holiday, Thanksgiving. 90% of people, I would say, probably didn't eat their Thanksgiving dinner with a mask on. And so, there are behavior characteristics that are going to continue to contribute to the spread of COVID-19. So case rates in the US are still quite high. This is a graph from Big Local News. It's representing the 14-day case rates for COVID across the United States. On the bottom, you'll see a timeline from the beginning of the pandemic to where we are now. There are 2 maps on this chart. The one on the left is December 10th, 2020. That just gives you an idea of what disease transmission looked like last December, which was incredibly high. And then the second map on the right-hand side of your screen is showing you what disease transmission looks like now. On those maps, the darker red are areas with more cases of COVID. So though we are a little bit lower in disease transmission now than we were last year, case rates are still incredibly high, and we still need to take mitigation measures to protect yourselves, your families, and those around you. So with the increased case rates and COVID still being very prominent in this country, masks are still recommended for all persons in public or crowded settings in 91% of the counties of the US. This chart is from CDC. This is based on CDC guidance. The dark red and orange are areas that have higher saturation rates of COVID, and therefore you should use your public health mitigation strategies, washing your hands, wearing your mask, keeping your distance. You'll notice that there are a few areas that are blue, which shows low transmission. I will note that though there are areas that are blue, many of those counties actually have no data to represent anything. Therefore, it's blue, but really, since there's no data, it's really unknown. So the one thing that we've heard a lot about in the news lately is the Omicron variant. Omicron is a variant. It's distributed globally. There's on the right-hand side of the screen, there's a map of the world. Anywhere that's highlighted is a location where Omicron has been reported. It is important to know that even though Omicron is arising and it's new and it's in the media, Delta is still the dominant strain in the United States. So there's a lot of media hype, but at the end of the day, there's still a lot we don't know about Omicron. And at the end of the day, both Omicron and Delta are COVID-19, which is a virus. It's a respiratory virus, and we have mitigation strategies we can use to protect ourselves. Next, I'm going to talk a little bit about vaccine effectiveness. So, as you know, there have been 3 vaccines approved in the US for use, Johnson & Johnson, Moderna, and Pfizer. We have had, the older populations have been able to get these vaccines since really January of 2021. And so the graph on the left-hand side is going to give just a general overview of a time lapse of vaccine and death rates. So this slide is mainly to prove to show that though people are vaccinated and people can still get COVID-19 and can still ultimately die, the rate of death and severe illness once you're vaccinated is incredibly lower than those in the unvaccinated population. So one note, which is interesting, is that the booster uptake, so we have booster shots. Booster uptake is highest in the over 65 population. Part of that is likely due to the fact that the over 65 population was vaccinated first, and so they were eligible for a booster first. But it is important that we all do our part and get our boosters as soon as you are eligible. The last thing I'm going to talk about is vaccine rollout for the 5 to 11-year-old age range. So 5 to 11-year-old age range, they're represented on this graph. So this graph is a graph of every age range and their vaccination and the vaccine uptake, meaning how many vaccines have we gotten in arms over a timeline period. So on the left-hand side of the graph, you're going to see January of 2021 when the vaccines first became available for the over 65 population, and you're going to see that the 75 plus and the 65 and up categories, which are the dark purple line and the purple spotted line, both of those had almost immediate uptake, and that's because there was a big surge and a big rush to get those older persons vaccinated early on due to their vulnerability. Later in April of 2021, you start to see the lower aged populations start to have that same surge. That's because that's when we saw the release date of those age groups, and they were then eligible to get the vaccine. If you look at the bottom, there's a yellow dotted line that goes all the way across to October and beyond, and then it starts to tick up. That is our 5 to 11-year-old age range. So that's just showing us that over time, we didn't have any 5 to 11-year-olds vaccinated. They weren't eligible. A vaccine was not approved. And then once we had an approved vaccine, we have started to see an uptick in vaccination of that age category. It's important to note that though we're seeing an uptake, the uptake is slow. So overall, this is a chart that shows us vaccination increase over time. And so early on, we saw huge surges in vaccination, and that was because once we had a vaccine, we had a medical countermeasure. People were pretty gung-ho to get it and protect themselves and protect their families. And so we saw that huge surge pretty much from December through April. And then we started to see a little bit of a decline in vaccine uptake. Part of that was because we had a lot of people who maybe already got their vaccines, or there were people who were maybe a little bit resistant or hesitant. And so we did see numbers drop. As of right now, we are starting to see that there's been an increase in vaccinations again, and this likely is driven by the federal mandate to be vaccinated, children's vaccine approvals, and boosters being increasingly available to all populations. So vaccine uptake, like I said before, has been slow in 5 to 11-year-olds. This is a chart that shows you how many daily doses are administered between for the 5 to 11 age range on a daily basis. So it starts in November, it goes through December. You saw that there was, again, that initial surge. People were excited to get their kids vaccinated, those who wish to, and we're starting to see that taper off. So about 3 in 10 parents say that their 5 to 11-year-olds have already received the COVID-19 vaccine or will do so right away. That's good news. People love their kids. People want their kids to be vaccinated. They want their kids to be protected. And so seeing that a third of the population is pretty gung-ho to get started and do that right away is good signs. We do need to really focus on those people who are in the wait and see category or who are uninterested in vaccinating their children, and really focus on educating them and making sure that people are making the right choices with their family physicians for their family and their children. Lastly, I'm going to talk a little bit about just vaccine uptake among the 12 to 17-year-old populations. I didn't want to leave them out of the presentation, but there's also not been a ton of traction with this specific age group. I will say those between ages 12 and 17, there has been a greater uptake in this age group compared to the younger kids, which that partially could be due to the time that it's been approved, and it partially could be because people seem to have less concerns that maybe their 12 to 17-year-old may have symptoms versus their little kids. At the end of the day, we know vaccines work, and we know that people should get vaccinated as soon as they can. So with all of this, I know COVID is a little bit daunting at times. We are not powerless in the sense of, there's new variants, you're doing what you can. There are things that we can do to continue to protect yourself, your family, and your coworkers. Number one is get vaccinated. If you're already vaccinated, make sure you're getting your booster. Speak with your doctor. If you have questions, concerns, there are experts out there who are willing to chat with you. Get educated, get vaccinated. The second thing, use masking, physical distancing, and hand washing at high case rates according to CDC guidance. CDC is currently recommending that any place with substantial or high transmission, they mask, they physical distance, and they hand wash when in public or crowded settings. I am fully vaccinated. I still mask in public. I live in an area of high transmission. You just have to be smart. Prioritize your family's physical and mental health. This includes getting your flu shots. So right now we're starting flu season as well as continuing this COVID pandemic. Hospitals are already overwhelmed from COVID. Getting your flu shot is also doing your part in your community to keep yourself, your family safe from flu. Another thing we can do is continue to make decisions based on data and guidance from reputable sources. Right now, there's a lot of misinformation in the media. There's a lot of information in the news that's not supported or not successfully supported by science. It's really important to know where you're getting your news from and make sure that there are reputable sources or scientific articles supporting the claims in each article. And the last thing is be patient until community transmission declines or updated guidance is available. The pandemic is hard. People don't want to wear their mask and wash their hands and do all the things, but this is the time of year where we really need to have a big push to adhere to those public health mitigation strategies. That is all I have for today. Next up, Til, do you want me to kick it back to Tom or kick it to you?
Please, let's go ahead, Tom. Tom, we'll look forward to your comments, and then thank you, Anna. And we'll look forward to the questions. Tom?
Some key messages in reopening, holidays, and travel. You're going to hear a lot of the information that you heard with Anna, but it does bear repeating. So the key messages that we're discussing out there right now. one of the ones is, Anna touched up on it, where we're entering an uncertain time in the pandemic. The winter season is forcing everybody indoors in most of the country. We have the Delta variant, we have the Omicron variant, and we have flu season coming up. And then we have the holidays approaching very quickly, which will also force people even closer together. And that we have to be aware that could provide a continued increase in cases, hospitalizations, and unfortunately deaths. We're still learning about the Omicron variant. As Anna said, right now, the Delta variant is still the overwhelmingly dominant variant, COVID variant in the United States. However, it's becoming more of a issue overseas. And so we're looking to those reports to see what may be happening in the future here. As far as return to office plans, what we're recommending to clients is to continue their pause in the return to office plans, since we don't know what's going to happen, and now we're seeing an increase in cases and hospitalizations after a couple of months of a steady decrease. It's time to just see where the numbers take us, as Anna said. And as the last key message coming up is to practice those health mitigation strategies: masking, vaccination, hand washing, and distancing. So with the holidays coming up, we do have some information about this. We saw during Thanksgiving that many people were, it was business as usual. Families were planning on typical gatherings that we saw before the pandemic, and that could be problematic. So we're suggesting smaller gatherings. Of course, get vaccinated, including the booster. The booster seems to be even more important now, as we're looking at the Omicron variant. Continue physical distancing. Continue wearing well-fitting masks when you're indoors, certainly, and especially if there's folks that you don't know their vaccination status. Recently, the CDC recommends testing for everyone, no matter vaccine status, before attending any indoor family gathering. And that new recommendation just came out after the Omicron variant was discovered right around Thanksgiving. So for domestic travel, the basics still apply: vaccine, social distancing, and masks. Know the transmission levels of your destination. Not every place, as we saw with Anna's slides, not every place in the country has the same level of community transmission. So know what's going on if you're traveling in your destination. If you're flying, you need to have a negative test 1 day before departure. That was moved up from 3 days. Check your destination's COVID situation, of course, and there's state and local governments may have different travel restrictions in place. And wear a mask. You're still required to wear a mask in all public transportation, as well as in the common area, the hubs of those public transportations. If you're not fully vaccinated, the recommendation is to stay home. And if you must travel, to get tested both before and after your trip. International travel, don't go if you're not vaccinated. That's still the recommendation. And international travel gets to be complicated. Different countries have different restrictions regarding testing and vaccination. For example, Mexico, which is a popular destination, does not require vaccination proof or testing. Countries like Japan, Israel, and Morocco have closed their borders to all non-citizens. And Canada, which is also close to to the United States, we doesn't require vaccination, but has other codes, other protocols, excuse me, such as health questionnaires and testing. So it's important to know what's out there. And the tricky part of it is it changes so much from day to day. All the information on the pandemic does, especially now when we're having things like the Omicron variant introduced. Most adult foreigner travelers do not have to be vaccinated. And this is what's new now. All travelers 2 and older must have a negative test 1 day before they return. So that's my presentation, and I will kick it back to Til.
Thank you, Tom, and thanks, Anna. That's a great information. Now, before we go to questions, we've been joined previously by Dr. Michael Anderson, pediatric intensivist, who is serving a lead role advising HHS ASPR on a number of response aspects, and has been really in the middle of the federal response, and has a number of thoughts. And so, Mike, if you could just share with us your thoughts on what's going on today related to COVID and related to Tom and Anna's presentations, and then we'll take some questions.
Really excellent presentations. Can you hear me okay, Til?
We have you. Go ahead.
Great. A couple of things. One, great presentations, great summaries, as always. I'll talk first about kids and then a little bit about therapeutics. First about children, I thought Anna did a very nice job of summarizing what's going on with vaccines. I think it's really important for us, both collectively as an organization, as well as individually as child advocates, parents, grandparents, aunts and uncles, to really know. And I saw Greg Lord put a question in the chat about the safety profile. The vaccines approved for kids are incredibly safe. And I think that first bump that Anna showed shows the really enthusiastic, engaged parents that want their kids vaccinated. And I think the rest of those some 20 million kids, plus or minus, maybe it's more than that, that's going to be conversations between the parents and their pediatrician or their family medicine doc or their nurse practitioner. I can just tell you, as a child advocate and an intensive care doc, and most importantly, a parent and a grandparent, the pros of this con really outweigh any safety concerns. It's been proven to be safe. And even though, thank God, and I've said this several times in these town halls, thank God kids do not seem to get as sick as adults with this virus. There are kids that do get sick, and many kids, unfortunately, have died or been in intensive care. This is a really nasty virus. Number two, we don't know the long-term complications of kids who get really sick. Multiple kids have this strange disease called MISC, and they have coronary artery abnormalities. We have no idea what the long-term consequences are going to be. The incidence of type 1 diabetes, insulin-dependent diabetes, since COVID has just skyrocketed. So there's some scientific tie with getting COVID or being exposed to COVID and potentially getting type 1 diabetes. And we know that variants emerge when the virus has had a chance to replicate. So the more of our citizens we can get vaccinated, the less we're going to hopefully have to worry about variants. So I know it's just down to age 5. I know the manufacturers are working down actually to age 6 months, but I think we as children and child advocates have to realize the pros really outweigh the cons. The second thing about kids, it remains very concerning what children's hospitals are undergoing right now. There has been a bit of a COVID surge. There was a very early, another virus called RSV, staffing shortages, which our clients talk about all the time, nursing, respiratory therapists, burnout, some predatory behavior by the staffing companies that are swooping up nurses who are getting $8,000 to $10,000 a week. Children's hospitals are really feeling that strain at a time when they're very, very busy. So Once again, to me, it makes a public health argument for as many kids as we can get vaccinated, the better our country is going to be. Let me shift briefly. As Til mentioned, I'm honored to be a part of a very big federal COVID response. As we go into what I think is going to be a very challenging winter, I'm really impressed to see all the incoming therapeutics that the manufacturers are bringing forward. AstraZeneca has a new pre-exposure prophylaxis monoclonal antibody. There are several approved for post-exposure prophylaxis, and there are 3 EUA-approved monoclonal antibodies for treatment of patients that are positive. That's all really good news. There's 2 potential oral medications coming down to treat COVID, one by Merck, one by Pfizer. Nothing EUA approved in the orals yet, so a lot to work out. But we don't know what Omicron brings to this. We don't know the data around, is Omicron still going to be sensitive to these antibodies, to these orals? So if you need a 150th argument that we need to get our nation vaccinated, I think Omicron and God forbid any other variants from there are really important. So always honored to be on an Aveshka town hall, and I'll turn it back to Til Jolly.
Thank you for that, Dr. Anderson. And now we've got a number of questions in the chat. Feel free to add some more. And I'm going to turn it to Carissa to help to manage the chat questions, and we'll distribute them among our team and hopefully get you some answers. Carissa?
Hello, everybody. Okay, so the first question, natural immunity. The doctor says it gives us good, if not better, protection than the vaccine. What is your take on this position? And is there any research showing that the vaccine is better than natural immunity?
Mike, I'm going to ask you to initially answer that. I have some thoughts also.
I tend to get a little hypertensive when I hear that. I don't believe that there's any data that shows natural immunity is long lasting, or certainly not as long lasting or as effective as 2 hits of an mRNA-based vaccine with a booster. I would not risk this notion that natural immunity is better than the vaccine. I don't believe that. I don't believe the data. Let's be data and scientifically driven. I don't believe the science shows that. And I just think that's a false narrative. And I'd be anxious to hear what Til thinks.
Yeah, I agree. And I try to manage my blood pressure a bit also, but this is unfortunately, a subset of the medical community is putting out some information that is really not serving patients well, to be quite honest. The data is quite clear. There are multiple studies that support this in multiple ways. The reason is because, first, it would be foolish to say that you don't get some immunity from being infected. That's how the immune system works. So yes, there is some immunity from being infected. The problem is that the natural immunity from COVID infection, like the natural immunity from many infections, is inconsistent. It depends on the severity of the case, depends on the exposure, depends on your own immune system. We have very clear data from multiple studies, and we can perhaps, post some of those and figure out a way to get those around to our staff. That shows that immunity wanes quite quickly from many natural infection-induced immunities. And it's certainly boosted. And there's studies that show in comparative populations an improvement in outcome and a lessening of case loads in those that are vaccinated and previously infected versus those who are not vaccinated in multiple different iterations. And that data has been going around for months. So our advice and the advice of the vast majority of the scientific community is, regardless of whether you have been previously infected or not, vaccination provides a significant added benefit with very little downside, if any.
Okay, next question. Can you explain why Florida, which was previously notorious for as a hotspot and is now labeled as moderate transmission? Does that mean that people have achieved a level of natural immunity, or what's the reason why the transmission is now considered low? I've read a lot of conflicting reports on how these cases are reported throughout the country. Can you shed some light on this?
There is a lot of conflicting information, and I'm going to ask you to perhaps join in and talk a little bit about the progression of this data and some of the complexities of collecting it in Florida and in other places.
I'm actually going to tag this to Emily. We have our epidemiologist, Dr. Lankau, on as well.
Dr. Lankau. You watch this week to week, which our teams do. You see changes in reporting and changes in data, and we've all gotten used to looking at these maps and looking at these county level data without, and it makes it look much more specific sometimes than it really is, and much more accurate sometimes than it really is. It's really important to watch the trending. Emily, are you there?
Hear me now.
Yes, you might need to speak up a little bit more, but I can hear you a little bit.
Right. Teams is giving me a hard time today. So exactly what Til just said.
Sorry, you're very quiet. I don't know if you're going to need to speak up more loudly or get closer to a mic.
So Teams is giving me a hard time today with sound, but Til is exactly right. We can't compare apples to oranges, and Florida is at a different place in the outbreak right now than other parts of the country. When Florida was hot, it was very, very hot. So a lot of people were infected. You're layering that on top of vaccination. So right now there may be a certain level of immunity that is holding and suppressing this virus. But what we're seeing in areas like Miami is they are starting to come back up again. So without solid vaccination and mitigation strategies, Florida is still at risk of having another wave of virus come through, really if Omicron is off. So we have to be really aware that different parts of the country are at different places during the course of this outbreak, and so we can't compare what's happening in Florida to what's happening in Wisconsin because the demographics and the conditions are very different right now.
Thank you, and I'll just add in there. Sorry, it was a little hard to hear you, but we could hear you. It's interesting to watch this week to week. I mean, we've all been on calls. Multiple of us have been on calls with our clients, and even 2 weeks ago, Florida looked even more optimistic than it did on the chart that Anna showed you. But if you notice the difference week to week, there have been upticks in case counts, particularly in South Florida. And all this is very cyclical. There were times when the Mountain West was horrible, and the Mountain West has gotten a little better. Now the worst area is the upper Midwest, Michigan, and other places. And so it really it varies regionally. It varies related to case counts. It varies probably related to weather and exposures and many other issues. And we're going to probably continue to see this regionally. Some areas getting better, some areas getting worse. And watching the trending, you do see that over the last couple of weeks, things in South Florida have started to tick up a little bit. Next question, Kristen.
What untoward effects have been observed or documented in 5 to 11-year-olds?
Dr. Anderson.
Yeah, so far the safety data looks really good. One of the things that the FDA panel, when authorizing it down to age 5, looked at was the rare complication of myocarditis or inflammation of the heart. And from the calls I've been on, that appears, I don't want to say non-existent, but really very, very small. So once again, gathering more experience appears to be very safe, and side effect profile so far from the data coming in looks incredibly safe.
On that note, with children, are there severe cases of children younger than 5 that are affected with the Omicron virus?
So far, we've not seen a lot of kids with Omicron. The data from South Africa, once again, early data shows it is very transmissible. South Africa does have children infected with Omicron. It appears to be mild. I'll just take that question to the next level. Mike's personal opinion, not not the ASPR opinion. It's just disconcerting that Omicron appears very, very contagious, and R naught that Emily and others would understand better than I, that shows it can spread very, very rapidly. So even if it's less dangerous, the more patients that get it, I'm just concerned that we will have yet more patients seeking medical care if they're unvaccinated or unboosted, that are going to overwhelm our already just beleaguered healthcare system. So I know that wasn't the question, but I think going into the winter, I would agree with our two speakers. We don't exactly know what Omicron is going to mean. I'm just worried a little bit about the math, that a lot of patients being infected, even if it's a small percentage that get really sick, that can add to an already stressed healthcare system. So tell people to get boosted. Tell people if they're not vaccinated that we've got to get this nation better vaccinated.
Thank you for that. With data showing Omicron cases are mostly breakthrough cases, does having both shots plus booster at least help reduce the severity of symptoms or even the reduction of death rate?
I'll take a bit of that, and Emily or Anna may want to weigh in on the data. The truth is, we actually don't know a lot about this yet. We're very early into this Omicron outbreak, and trying to divide it out. I mean, it's really only what 2 or 3% of the cases in the U.S. It's obviously a larger percentage in South Africa and in some certain parts of Europe. We've applied this term breakthrough. It almost sounds like a failure. And it's really not a great term from a communication standpoint. Tom may have thoughts on that, but we certainly are seeing, with at least the early data, a reduction in severity in across all the various variants. We assume that's going to happen with Omicron. It's really just a matter of more data, but there's nothing to suggest anything other than the guidance of get vaccinated and get boosters at this point. Next question.
All right, on mute. Okay.
Okay.
Any other advice for the holidays since we expect a surge in cases?
Tom, I may turn to you. That relates to some of the things you were talking about.
Sure, thank you. Just the general information that I discussed before. Don't assume that the pandemic is over or on a decline. So take your precautions, get vaccinated, get the booster shot. Use those other mitigation strategies we have at our disposal: hand washing, smaller gatherings, easier for social and physical distancing, and masking, of course. Just keeping that up. The biggest thing is, and we saw that a little bit during Thanksgiving, is people might think the pandemic is on a decline, and it's not. And with everybody being forced inside, or most of the country, it does set up a better environment for disease transmission. So those things, just to reiterate those things, you can't talk about them enough, actually.
And one thing that I'll add in, I'm not an expert on this, but that hasn't taught me before. It's something that Anna and Emily have taught me about the way the data is gathered. The data gathering, the public health data, is very dependent on people, and we don't have enough people and resources to do this. And recall that over the coming holidays, both the Christmas holiday and the New Year's holiday are times when people take off in various settings. And those people are the data gatherers. And so we may actually have, if you take a look at the data the first week in January, it may look like things dropped over the last 2 weeks of December, when in fact they just weren't being reported very well. So if you come back from the holidays and say, oh wow, the curves look better, be careful, because a week later they may look worse because of data gathering. Next question.
Do you see continuous boosters every 6 to 9 months?
Mike?
I'm hopeful we get to a place where it becomes even flu-like, in that we've got the variant or variants that we're worried about, and then we can craft a once-a-year booster. I think that's to be determined in 22. I will say that the two current approved mRNA-based vaccines should provide the country writ large with comfort that they can be tailored relatively quickly. And I think that's why you've seen good data with the booster to date, that it is these two mRNA-based vaccines are readily modifiable. So it's going to take a while to get to endemic, but I do think that we will probably see some sort of either yearly or maybe more frequently booster. We've just got to get the pandemic to some endemic before we get there.
And there's one thing that Chris, I see there's a question somewhat related to boosters. I might ask Mike to comment on the J&J vaccine, the booster, which people have gotten. It's a smaller number than the mRNA vaccines, but certainly an issue.
Yeah, I think that the recommendations I've seen, and I've actually given to family members, including but not limited to one of my children, who got J&J, is that if you can get a booster with an mRNA-based vaccine, either Pfizer or Moderna, that's probably the better way to approach it. I also see there's a question in the chat about mixing. I think, think that the official CDC guidance is mixing is okay. I don't know if there's, quite frankly, I don't follow it, but I don't know if there's much data. If you've got two Pfizers, are you better off getting a Moderna or vice versa? I think I just got a booster based on where I could get it. It really didn't, to me, matter if which one it was. It was more logistics.
Yeah, and that's consistent with the advice that we've been giving our clients. I mean, I think, people have been, there's a lot of question that we get from our clients about one vaccine versus another and which one's better. The really dramatic thing you see when you see the curves of relative risk of hospitalization and relative risk of death with no vaccination versus the vaccines is that the three lines of the vaccines are all quite close near the bottom, and the unvaccinated line is quite high for both hospitalizations and deaths. So it's a bit of a fine point among all the vaccines. The important thing is to get vaccinated.
Okay. A person wrote here that they've read many articles showing the increase of vitamin D levels drastically reduced death by 80% in COVID patients. Why is this not spoken of in mainstream media or by doctors or by doctors in forums like this? If people could add vitamin D to their diets, it would save many lives for unvaccinated and vaccinated individuals, particularly of people of color who have high levels of melanin in their skin and normally have low levels of vitamin D.
I don't know, if Mike, if you have any thoughts on that, I have a couple.
All you.
All right, I don't know that data. I'm happy to review it, and if you want to, I don't have that study. If you'd like to, the person who asked that, if you send me a study, I'm happy to look at it. Vitamin D is another one of those supplements that yes, you do need, and in fact, you get it in your body from you're part of it from sun exposure, and with all the concern about skin cancer, we frequently ask people not to expose themselves so much to the sun, and so. There probably is nutritionally a reason to have some vitamin D supplementation. At a certain level, it doesn't do very much nutritionally, but there is a certain level required. I would have to look at the study and see if there's truly an 80% reduction in death rate. That's pretty dramatic. I'm a little skeptical, to be honest, but I'm happy to look at any scientific article that reviews it.
Okay, we'll make a note of that. Another question, I've been hearing about people taking ivermectin as an alternative to vaccines. Can you explain the dangers of doing these types of alternative ways of fighting COVID?
There are a number of issues. Mike probably has some thoughts too. Ivermectin and a couple of other medications have been marketed as potentially good for this. First, there's no really good evidence that it works, and certainly it's not as an alternative to vaccines, because a vaccine, let's just say you were going to take a medication that's an alternative to vaccines, you would need to take it daily for an infinite amount of time, assuming that it even worked that way, which it doesn't. And ivermectin and a couple of other drugs have significant side effects, and there are physicians who will prescribe it. There are a small number, and there are pharmacists who say, I won't fill this because it's not intended for that use. And they're well within their rights to do it. We know that ivermectin is useful in the animal population as an antiparasitic drug, and we know of farm supply houses running out of it, which is just a danger for patients. Mike?
My second hypertensive moment of the day. Ivermectin is a horse deworming medication. There has been zero evidence it has any role, and I don't know how we as a nation got to a misinformation point where science is disregarded and some sort of false narrative is promulgated. There are thousands of people dying every day of this terrible disease. We have safe and effective vaccines, and we need to rise above. I know it's a very tense time, and it's unfortunately a very divided nation. There's no evidence that ivermectin does anything except help horses, and there's amazing evidence that getting vaccinated can save your life and stop this pandemic. So there's zero evidence. There's zero evidence of ivermectin or the other stuff that's been out there being useful. You got to get vaccinated, period.
Okay, I think that is all the questions that we have. Do you have any last statements or things that you'd like to let our employees know?
I see the article that someone posted, and I'll take a look at it. Thank you. There is a question. There's a related question about mixing of vaccines and whether it's a normal practice for giving vaccines in general. It actually isn't, but that's not because it's not scientifically valid. It's really a business issue. Remember, vaccines are, they're commonly given. We get them all throughout our lives, very heavily in childhood and then later on. And there's usually one or maybe two sources of vaccines from a business standpoint that are pretty standard in the supply chain. There's no emergency involved. And you just kind of get them. You don't even really think about the manufacturer they came from. Through what was called Operation Warp Speed, a number of manufacturers, more than just three, multiple others were going down a path trying to develop an effective vaccine. Several fell by the wayside because they either weren't safe or weren't effective or both. But the three that really passed muster were these three. And so now we have three manufacturers putting out three vaccines that are, two of which are pretty closely related, a third that's somewhat different, but all with a similar effect. And so we're now in a practical situation of having the ability to mix. So it's not normal, with air quotes normal, but it's certainly acceptable, and it's a situation that's been generated by how we came to this. So I don't see any other questions. I really appreciate the time, and I want to thank Anna and Tom and Mike for joining in, and Emily for also joining in with an answer to a question. As I pointed out earlier on, we have a large team beyond just the five of us that our clients benefit from every day, and hopefully you benefit also. We work pretty hard to really get good information out and grow our guidance to both the government sector and our private sector clients. We've been at this a long time. This has been, very tough on all of us. All of us, our lives have been upended and changed in many ways. And I encourage you to sort of watch the science, watch the data, reach out to us as needed. If you have other questions that are offline that you want to ask, feel free. We would be happy to answer them and help along the way. And also continue to encourage you to, take time for yourself, take time for your family, take time for your kids, and really work on your mental health and your wellness aspects also, because that's something that we've all suffered through over time, and it's important that you take care of yourselves, your families, and your loved ones. And so with that, I'm Carissa. I'm going to close and turn it back to you. Thank you.
Thank you. So, and for our team, in terms of the reputable sources and things that we should be referring to, if Emily or Anna, if you can send that to me, and I will make sure we get that out to our folks. Just places to look for the right information, I think would be helpful. Thank you. And that is all for today. Thank you for joining us this afternoon. We greatly appreciate your time. Again, we will make this recording available to everybody, so please be sure to share the information with your customers, with your clients, with your friends, and with your loved ones. We want to do everything we can to help improve the COVID situation in our country. So please share the knowledge. Thank you so much to the public health team.